In this session, we'll be dealing with the meninges. So before going to meninges, we'll see what does actually the CNS contain. The CNS contains the brain and spinal cord. So these are the major parts of brain, the cerebrum, cerebellum. So hidden here will be the diencephalon, midbrain, pons, medulla. These three together called brainstem. You can see the cerebrum is divided into two halves by longitudinal cerebral fissure. You can see the two cerebral hemispheres. You can see this is the frontal pole, this is the occipital pole. We'll study all these in detail when we are dealing with the cerebral features. You can see this is the inferior surface. The stem of lateral sulcus divides the inferior surface into orbital surface and tentorial surface. You can see these are the gyri and these are the sulci. You can see this is the cerebellum, brainstem. That's superolateral surface of the cerebrum. So if you observe, there are actually 5 lobes. So this is the central sulcus, this is the posterior ramus of lateral sulcus. So here this is the parieto-occipital sulcus, this is pre-occipital notch. So we draw a first imaginary line here, and from the posterior ramus of lateral sulcus we extend a second imaginary line. So this divides the cerebrum into 4 lobes. The frontal lobe in front of central sulcus, then the parietal lobe, and you can see below the posterior ramus and second imaginary line you can see the temporal lobe. So behind the first imaginary line there is occipital lobe, and here hidden within the posterior ramus of the lateral sulcus there will be insula or island of Riehl. You can see here this is the insula or island of Riehl. You can see these are the short gyri, gyri brevia, and these are the long gyri, gyri longa, and you can see the sulcus centralis. So these are few named gyres, like you can see this is the central sulcus, in front of it this is the frontal lobe. So in the frontal lobe you are seeing superior frontal, middle frontal, inferior frontal gyri. You can also see the precentral gyrus. So we deal all these gyri and sulci especially when we are dealing with the features of the cerebrum. So this is just for introduction purpose. And within the core of the cerebrum we can also see the diencephalon features like thalamus, and you can see the basal nuclei like caudate nucleus, lentiform nucleus. You can see the amygdaloid nucleus. So basically if you see the architecture, there is an outer gray matter, then white matter, and in the central there are few nuclei of gray matter. This is the medial surface of the cerebrum. The chief feature will be this corpus callosum. Then you can also see the parts of brainstem here, the pons, midbrain, medulla, and you can see the fourth ventricle, you can see the third ventricle. You can see here the cerebellum. So this is the inferior surface, you can see this is the orbital surface and tentorial surface. So if you want to see the complete tentorial surface, you need to remove the cerebellum. So this is the pons, this is the interpeduncular fossa. So here the parts of the midbrain will be cerebral peduncles. So this between these two cerebral peduncles, there will be interpeduncular fossa. So this is the pons acting as a bridge between the two cerebellar hemispheres, and this is the medulla oblongata. You can see these are the elevations called pyramids. The same picture representing the inferior surface of the cerebrum. So all these we deal when we are dealing in detail with the cerebral features. This is just we are introducing the parts of the CNS. You can see this is the interpeduncular fossa. You can see these are the cerebral peduncles. So cerebral peduncles bounded posterolaterally and anterolaterally by the optic tract. Here you can see anteriorly with the optic chiasma, posteriorly with the pons, and you can see the posterior perforated substance. All these form the interpeduncular fossa. So this will be the location of interpeduncular cistern. So you can see here there's a parts of the brainstem, midbrain, pons, and medulla. You can see this is the fourth ventricle. This is the choroid plexus of fourth ventricle. This is the cerebellum. You can see the midbrain section appears somewhat like this. You can see this is the chief feature, the substantia nigra, the red nucleus. These are located in the midbrain. And here you can see this is the tegmentum. And here you can see this is the cut section through the medulla oblongata at the level of olius. So this is the cerebellum. There are two cerebellar hemispheres connected by the vermis. So this also we have two lectures separately, cerebellum 1 and cerebellum 2. where we study all the features of the cerebellum in detail. And you can see the section of a spinal cord. You can see the head-shaped gray matter. There's the posterior horn, there's the anterior horn, there's the lateral horn, which is specially present in the thoracic region for sympathetic system. And you can see this will be the anterior funiculus, this will be the lateral funiculus, and this will be the posterior funiculus, the white matter. Same thing again, lateral horn, posterior horn, and anterior horn. So these are the ventricle. You can see this is the lateral ventricle. Actually, there will be two lateral ventricles. That's why we have third ventricle and then the fourth ventricle connected by the cerebral aqueduct or aqueduct of Sylvius, which is the cavity of the midbrain. The cavity of medulla and pons together forms the fourth ventricle roofed by the cerebellum. The cavity of the cerebral hemispheres is the lateral ventricle. The cavity of the diencephalon is the third ventricle. So interventricular foramen of Monro is the communication between the lateral ventricle and third ventricle. Here also there might be obstruction for the CSF flow. Cerebral aqueduct is the connection between the third ventricle and the fourth ventricle. Here also it can obstruct. And in the roof there is a foramen of Meninges, and on either side there will be foramen of Lashka. So those are the communication between fourth ventricle and the subarachnoid space. So any of these points can get blocked, resulting in hydrocephalus. When we deal at the end of this session, we'll deal with the hydrocephalus. So these are the causes, these are the sites of obstruction: the interventricular foramen of Monro, cerebral aqueduct, and then the three apertures in the roof of the fourth ventricle. The central aperture is the foramen of Meninges, on either side there will be foramen of Lashka. So these three apertures are the apertures through which the CSF from ventricles escapes into the subarachnoid space. So if you see the basic functions, the cerebrum, conscious perception of sensory modalities, conscious motor activity, cognition, that is the intelligence. Basal ganglia, control of muscular activity and posture, largely inhibit unintentional movement. Then limbic system, autonomic response to smell, emotion, mood, recent memory, etc. Thalamus is the major sensory relay center. If you see in lower vertebrates, thalamus is the highest sensory perceiving part of the brain in them. Influences mood and movement. Hypothalamus, major control center for maintaining homeostasis and regulates endocrine functions, also temperature. And subthalamus associated with basal ganglia and help in coordinating motor functions. Epithalamus, sleep-wake cycle, smell. Then brainstem contains ascending and descending nerve tracts, houses nuclei of all cranial except first and second. And the midbrain is concerned with visual and auditory reflex centers, pons, relay center between cerebrum and cerebellum, and houses sleep center, medulla, center for several vital atomic reflexes like heart rate, breathing, swallowing, and vomiting. Cerebellum, control of muscle movement and tone, regulates extent of intentional movement. So now coming to the actual topic, the cranial meninges. So the cranial meninges, the first thing we are going to see is the dura mater. So dura mater is also called as pachymeninx. It is thick. It has two layers. In the cranial dura, there are two layers: outer endosteal layer, which is attached to the bones, and then inner meningeal layer, which becomes continuous with the spinal dura. So dural folds are formed mainly four: the falx cerebri, falx cerebelli, tentorium cerebelli, and diaphragma cellae. So the main function of this dural folds is actually they restrict the movement of the brain substance within the cranial cavity. They restrict the movement of the brain substance so that it is not subjected to shock. So dural septa divide the cranial cavity into compartments to separate the different parts of the brain. So they restrict the movement and they enclose intracranial dural venous sinuses. I'll show you what are these dural venous sinuses. So there are four folds, namely the falx cerebri, falx cerebelli, tentorium cerebelli, and diaphragma cellae. So then dural venous sinuses, there are two layers as I said earlier. The two layers will separate and enclose venous sinuses or venous channels. These are called dural venous sinuses. They have been classified into paired and unpaired. There will be a separate lecture on dural venous sinuses. So you can see here the falx cerebri, it is sickle shaped. I can show you. So this is the falx cerebri, sickle shaped. Here it encloses superior sagittal sinus and here it encloses inferior sagittal sinus. And it also encloses straight sinus at the point of attachment of falx cerebri with the tentorium cerebelli. You can see this is the tentorium cerebelli, which forms roof of the posterior cranial fossa. You will understand it when we deal with the osteology of the interior of the cranium, whereas the interior of the cranium is divided into anterior, middle, and posterior cranial fossa. You can see this will be the anterior cranial fossa, this will be the middle cranial fossa, and this will be the posterior cranial fossa. The posterior cranial fossa is roofed by the tentorium cerebelli, a tent-like dural fold. So this tent-like dural fold is having a free margin and also is having a attached margin. The free margin, otherwise called the tentorial nostril, that will allow the passage of the brainstem. Then you can see here the diaphragma cell, which actually is roofing the pituitary fossa, the sella turcica. And last but not least will be the false cerebelli. You can see this is the false cerebelli. So this goes into the fissure between the two cerebellar hemispheres from posterior aspect. You can see this is the false cerebri, which goes into the longitudinal cerebral fissure and separates the two cerebral hemispheres. So false cerebri, diaphragma celli, tentorium cerebelli, and false cerebelli. So tentorium cerebelli is forming roof above the cerebellum or above the posterior renal fossa, and false cerebelli separates the two cerebellar hemispheres. So you can see here this is the false cerebri, superior sagittal sinus and inferior sagittal sinus. You can see along the attached margin of the tentorium cerebelli there is transverse sinus. So this will be the tentorial notch through which the brainstem passes. So dural venous sinuses. So there is a separate lecture on this, so don't worry. So this is just the classification. So there is a separate 1 hour lecture. The classification of dural venous sinuses: unpaired, superior sagittal sinus, inferior sagittal sinus, straight sinus, occipital sinus, anterior intercavernous and posterior intercavernous and basilar venous plexus. So paired sinuses will be spinoparietal sinus, cavernous sinus, suprapectoral, inferior transverse sinus, and sigmoid sinus. Most important will be the cavernous sinus. You can see here, this is the cavernous sinus, anterior intercavernous sinus, posterior intercavernous sinus, spinoparietal sinus, middle meningeal vein. This is the superior pectoral sinus, this is the inferior pectoral sinus. And you can see this is the transverse sinus and this is the sigmoid sinus. Sigmoid sinus will continue as the internal jugular vein. You can see this is the section through the cavernous sinus. This will be the lateral wall, the medial wall, the inferior wall, and the roof. So this is the pituitary fossa, sella turcica. Diaphragma cilia will be actually forming the roof here. You can see the important nerves in the lateral wall of the cavernous sinus, the oculomotor trochlear, the ophthalmic division of the maxillary nerve, and the ophthalmic division and maxillary division of the trigeminal nerve. You can also see the abducent nerve here in relation to the renal carotid artery. You can see the sphenoidal air sinuses below the pituitary fossa. So all these will be dealt in detail when we are dealing with the cavernous sinus. So now what is the difference between the spinal dura and cranial dura? So if you see the spinal dura, it is single layered and consists of meningeal layer only. And if you see cranial dura, it's double layered and consists of an inner meningeal layer and an outer endosteal layer. So it does not form folds, forms folds, that is false cerebri, false cerebelli, tentorium cerebelli, and diaphragma celli. So epidural space present, epidural space is absent. So the arachnoid matter, it's a delicate vascular membrane, bridges the sulci and fissures. So only at two places it does not bridge, it will go there into the fissures and sulci. So these two places are the lateral sulcus and the longitudinal cerebral fissure. Then so this is how you are going to differentiate the pia mater and arachnoid matter. If you get the full specimen, when you see the gross main specimen, there you can see the sulci will be bridged by a thin delicate vascular membrane. So that membrane is the arachnoid matter, whereas pia mater will dip into the sulci. So arachnoid and pia mater together called as leptomeninges, whereas dura mater is called as pachymeninx. The process of arachnoid are the arachnoid villi and arachnoid granulations. So this arachnoid villi will project into the dural venous sinuses and there will be absorption of the CSF. The arachnoid granulations are also called as pachyonian bodies. So these arachnoid villi will become pedunculated and enlarged to form the arachnoid granulations. So these actually they project into the venous lacunae. Arachnoid villi will project into the venous sinuses. Arachnoid granulations will project into the venous lacunae. You can see here these are the arachnoid granulation, and here you can also observe here. So whenever the blood vessels are entering into the substance of the nervous tissue, you can see the arachnoid matter is lining and there is a pia mater, and between them there is a perivascular space that is called as Virchow-Robin space. So pia mater, it's thin transparent vascular membrane. So perivascular sheets around blood vessels, which I have shown as Virchow-Robin space. So tila choroidal the ventricles. So this is nothing but the vascular pia with ependyma lining the ventricles. These two will form the tila choroidae. When this is added by the tuft of blood vessels, we call it as choroid plexus. So these choroid plexus are responsible for the production of CSF. They also form sheets for cranial nerves. So you can see here, these are the tila choroidae and choroid plexus of the lateral ventricle. And here you can see these are the tila choroidae and choroid plexus of the third ventricle. So choroid plexus for the lateral ventricle and choroid plexus for the third ventricle. So here you can see, so these are the choroid plexus for the fourth ventricle. The most important thing is the subarachnoid cisterns. So the space between the Arachnoid matter and the pia matter is the subarachnoid space which is filled with the cerebrospinal fluid. So at certain places, the subarachnoid space presents dilatations filled with sufficient amount of CSF. So this spaces are called as subarachnoid cisterns. As you can see here, so between the medulla oblongata and the cerebellum, you can see a large cistern. It is called as cisterna magna or cerebellomedullary cistern. And on the ventral aspect of the pons, you can see cisterna pontis. And here you can see close to the interpeduncular fossa, you can observe the interpeduncular cistern where there will be circle of Willis. And here you can see the cistern of great cerebral vein, otherwise called as cisterna ambiens, below the splenium. So same way you can also see here it is not visible. The other cistern is the Sylvian cistern, which is in relation to the lateral sulcus. And here around the phylum terminale, the subarachnoid space becomes roomy and forms the lumbar cistern. So we can access the collection of CSF can be done from either the cisterna magna or from the lumbar cistern. Most commonest will be the lumbar cistern. You can also directly take CSF from the ventricles. So cerebellomedullary cistern or cisterna magna. So it is located in the interval between medulla oblongata and inferior surface of the cerebellum. So not major important contents are present. Pontine cistern or cisterna pontis on the ventral surface of the pons. Basilar artery and its branches. Interpedicular cistern, otherwise called basal cistern. So it is at the base of the brain in the interval between the two temporal poles. So main constituent is circle of Willis or circus arteriosus. So cistern of lateral sulcus or Sylvian cistern. So in the stem of the lateral sulcus in front of the temporal pole, content is medial cerebral artery. So cistern of great cerebral vein of Galen or cisterna ambiens in the interval between splenium of corpus callosum superior surface of cerebellum. So great cerebral vein of Galen. So spinal meninges again 3 dura mater, but the difference is here only one layer, the meningeal layer only. So it extends up to S2 vertebrae, second sacral vertebrae. Arachnoid matter, thin transparent membrane, extends up to S2 vertebrae. Pia matter, it's highly vascular. It shows some important modifications like this. So let us see the spinal meninges. You can see this green color one. This is the dura mater. Outside dura mater, you can see this is the epidural space where drugs can be injected. So most commonly used procedure in anesthesia, epidural anesthesia. So then you can also see the subdural space. You can see here there is a subdural space between the dura mater and the arachnoid mater. You can see this dark one. This is the arachnoid mater, and you can see this is the pia mater. So this is the subarachnoid space where CSF is present. So let us see the modifications of the pia mater. Phylum terminale. So that is once the spinal cord ends, below that the pia mater continues as a thin, delicate, glistening white thread-like structure called phylum terminale. So it extends from tip of conus medullaris to first coccygeal vertebrae. So it is divided into two parts, phylum terminale internum and phylum terminale externum. So internum is 15 centimeters, extends up to S2. It is within the dural sac. So once the dural sac ends, whatever pia which continues down is the phylum terminale externum. 5 centimeters reaches the coccyx. Then what is linea splendens? The pia mater gives a septum into the anteromedian fissure of the spinal cord. So the line of attachment of this septum is thickened to form the linea splendens. So first modification is the phylum terminale. The next one is the linea splendens. So next subarachnoid septum. So mid-sagittal fenestrated pial septum connects dorsal surface of spinal cord with the arachnoid. I'll show you in the diagram next. So ligamentum denticulata, most important clinically. So two transparent ribbon-like bands are present on either side of the spinal cord, which separates the ventral aspect from the dorsal aspect. So with 21 pairs of tooth-like processes. So now here you can see this is the phylum. So this is the end of the spinal cord conus medullaris. You can see here this is the lower end of the spinal cord, from where you can see there is extension of the phylum terminale. So this is within the dural sac. This is the phylum terminale internum, and outside the dural sac you can see the phylum terminale externum. You can also see in the third month, so the spinal cord is extending up to the coccyx. So at birth it is at the level of L3, and in adult it is at the level of L1. So this will be the phylum terminale internum, and this will be the phylum terminale externum. Now you can see here this is a subarachnoid septum. So connecting dorsum with the spinal cord with the arachnoid matter, and here the pia mater will give an extension into the anteromedian fissure. So from the point where there will be that extension will be beginning. So that point will be the linea splendens, and here you can see the ligamentum denticulum. So clinical importance here is this ligamentum denticulum acts as a landmark for identifying the dorsal sensory ventral motor root. So if you want to relieve interactive pain, so you can cut this dorsal root. So if you want to cut this, you need to identify the ligamentum denticulum and you have to put the knife behind the ligamentum denticulum. You can see here these are the ligamentum denticulata. So one more important point is the L1. So the L1 is in relation to the this last ligamentum denticulum, so which forms a tuning fork-like appearance with the terminal part of the spinal cord. So this L1 lies in relation to the last ligamentum denticulum. So this from this the nerve roots can be counted above and below, which is a very important landmark for the neurosurgeons. Now you can see this is a procedure, lumbar puncture. As you can see here, the needle is passed between the spinous process of L3 and L4, most preferred site. So usually if you see the two iliac crests, the highest points, if we connect, it passes through the spine of the L4. So a space above or below we can use for lumbar puncture. You can see the needle in the lumbar system. So cerebrospinal fluid, the CSF, the total volume is around 150 ml. 30 ml is in ventricular system, remaining is in subarachnoid space. It's a clear, colorless, slightly alkaline fluid. Specific gravity 1.005 to 1.008. So contains inorganic salts and traces of protein, glucose, like in blood plasma. Protein is much lower. Glucose is also lower than the plasma, whereas chloride content is slightly high. You can see here, protein 25 milligrams, here 600 in the plasma. Glucose 50, here in 100 milligrams in plasma. Chloride is 120 milliequivalents, whereas in plasma it is 100 milliequivalents. So calcium 2.5 and 4.5. So everything is less except the chloride. So usually what happens, the CSF is cell-free. Very few lymphocytes will be present. But in meningitis, the fluid becomes cloudy, protein is raised, and then the number of cells also increased. So CSF analysis has good diagnostic value. So about 80 to 90% is produced by choroid plexus of lateral ventricle, remaining by the choroid plexus of third and fourth ventricle. So process of production is not clear, either it is by secretion, filtration or dialization. So the average amount CSF formed per day is 500. You can see here these are the choroid plexus, lateral and third ventricle. So choroid plexus or tila choroidea of the third ventricle, choroid plexus or tila choroidea of the fourth ventricle. You can also see this choroid plexus in the fourth ventricle. These are the foramina of Meninges, these are the foramina of Luschka. So these are the three foramina from which the CSF from the ventricles will exit into the subarachnoid space. You can see here. So from the lateral ventricles through interventricular foramen of Monroe, it comes into the third ventricle, then cerebral aqueduct, then into the fourth ventricle, and then you can see the CSF is being escaped into the subarachnoid space. Then it passes around the brainstem, then through the tentorium notch, then reaches the inferior surface of cerebrum, then supralateral surface, then reaches the arachnoid villi and granulations which are projecting into the superior sagittal sinus, and there it gets absorbed. So any blockage in this entire passage will result in hydrocephalus. So you can see the arachnoid granulations, you can see the CSF being absorbed into the venous sinuses. So CSF circulation, so CSF in lateral ventricle, then interventricular foramen of Monroe, third ventricle, cerebral aqueduct, fourth ventricle, and through the three foramina of Meninges in the center and on either side foramina of Luschka, it enters into the subarachnoid space. And from the fourth ventricle, it also go into the central canal of the spinal cord, then subarachnoid space around spinal cord and cauda equina. So pial veins of the spinal cord will help in absorption. So foramina in the roof of the fourth ventricle, foramina of Meninges and foramina of Luschka. Cerebellomedullary and pontine cisterns. This is the cisterna magna, and this is the pontine cistern. Then through tentorial notch, inferior surface of cerebrum, superior lateral surface of cerebrum, then arachnoid villi and granulations, and superior sagittal sinus. So this is a pathway for CSF circulation. So anywhere it can get blocked. So if the block is up to this point, that is foramen of Meninges and foramen Luschka, so this entire thing will result in internal hydrocephalus or non-communicating hydrocephalus, If the blockage is outside, then it causes external hydrocephalus or communicating hydrocephalus. So causes either excess production of CSF or obstruction or defective absorption. Types non-communicating or internal. So CSF accumulates within the ventricular system. So blockage of exit of CSF from ventricles into suprachiasmatic space. So communicating or external, CSF accumulates in suprachiasmatic space. Blockage of arachnoid villi and granulations. You can see so disproportionately large size of head, then widely separated cranial sutures, enlarged and tense anterior frontal ellipse, thin scalp with dilated veins, solid retraction. So settings and appearance of the eyes, there will be dementia, there will be cranial paralysis, there will be bossing of forehead. These are all the features of hydrocephalus. Then you can see this is the herniation of the brain tissue. So any kind of space of occupying lesion like tumors, you can see this tumor is exerting pressure. So as you can see, the first one is the cingulate gyrus herniation from one side to the other. Then you can see the lateral tentorial herniation. So here the uncus of the temporal lobe is actually coming down through the tentorial notch. Then central tentorial herniation, the brainstem through the central part of the tentorial notch. Then cerebellar tonsil, you can see the tonsil of the cerebellum being herniated due to pressure here. Then you can see the herniation of brain tissue to the craniotomy defects, a surgical area. So the brain tissue is being herniated. So now the most important thing, the blood-brain barrier and blood CSF barrier. So the blood-brain barrier is having the following layers: the capillary endothelial cells, and the tight junctions between them, the basement membrane on which the capillary endothelial cells are arranged, and the foot process of the astrocytes that adhere to the outer surface of the capillary wall. You can see here. So this is the endothelium. So endothelium with the tight junctions, and you can see the basement membrane, and you can see the foot process of astrocytes. This forms the blood-brain barrier. Now let us see what forms the blood CSF barrier. So it is formed by the endothelial cells which are fenestrated. The fenestrations are not two perforations but are filled with diaphragm. The basement membrane of capillary endothelial cells. Okay, so this is the capillary part, and here you can see the basement membrane of choroidal epithelial cells and the tight junction between the choroidal epithelial cells. This is the ependymal part. And the scattered pale cells with their flattened process between the two base membranes. These are the modified pile cells. Let me show you. So this is the CSF within the ventricles. You can see this is the modified ependyma. So you can see the tight junctions between them. You can see the basement membrane, and here you can see the modified pile cells, and here you can see the basement membrane of the capillary endothelium, and these are the capillary endotheliums with the fenestrations which are filled with the thin diaphragm. So this is the blood CSF barrier. So blood CSF barrier and blood brain barrier, how they are different. You can see here this having capillary endothelium with the tight junctions. You can see the basement membrane, and you can see the foot process of astrocytes. But here it is capillary endothelium, fenestrated capillary endothelium, and the fenestrations are filled with the diaphragm, and you can see the basement membrane, modified pile cells. You can see the basement membrane of the choroidal epithelium, and then you can see the modified ependyma lining the basement membrane, and here these are the tight junctions. So this is blood CSF barrier, and that is blood brain barrier. Thank you.